I hope you are all well and coping well with your studies. Just a reminder for you all that as inshallah soon when conditions would be improved and you people would be back to campus, definitely you people would be spending much time for your clinical rotations. So it's just an advice, a sincere advice that you people should focus start more on studying community medicine and pathology, and you people should be well versed with the theoretical component so that when you are back on campus you can have ample time to continue with your clinical rotations. And I hope up till now you are getting clear. I am also getting a few queries on WhatsApp messages, and I will also cover those queries during this lecture because then it gets difficult to answer each and every query personally. From the last lecture, someone amongst you asked that how we can calculate the life expectancy at age 1. I would be dealing with this question during this lecture as well, inshallah. And just as a reminder, I am taking the module of concept of health and disease. This is the second chapter of PARC, and I'm covering those topics. Up till now, in the first lecture, we did with the concept and dimensions of health. In the second lecture, we did concept of well-being, including physical quality of life index and human development index. Today, in today's lecture, we would be having a detailed encounter of what is meant by indicators, how many types of indicators are used to determine and to measure health. Fine. This is the content of today's lectures. I would be telling you a brief introduction of indicators, how many types of indicators are there, their characteristic uses, what are the sources from which we get the data to calculate those indicators, classification, and that's it. Excuse me. Okay. This is the slide with which I started my previous two lectures. So I'm just stressing that how important this is. And just imagine if a student appearing in the Viva of community medicine and not knowing the definition of health, the WHO definition of health, what can be the state of the affairs? Because this is the third time I'm going to show this, and it's not a repetition. It's just to stress the importance of this definition because the rest of the module of community medicine is relying on this definition. So once again, reiterating that what is health according to World Health Organization, it is a state of complete physical, mental, and social well-being, and not merely an absence of disease or infirmity. Fine, we know this. The next thing is, okay, we have decided upon the definition of health, we have decided upon the dimensions of health, but now the thing is we want to assess that what is health and what is not health, or if we want to compare the health status of different countries, how can we do it? Definitely, if we want to make a comparison, first of all we have to measure it. Now the question arises, how can we measure health? One thing is for sure, health cannot be measured in exact measurable forms. It's not just the weight, basically we have the unit of kg, it's not the height, it's not some one, because why it's difficult to measure health? Because it has different dimensions. If health was just the biochemical concept, we have a range of biochemical tests and we can measure health accordingly. If health was something only psychological dimension, then we have a number of anxiety depression scales, we have a number of scales to assess the mental status, but these are the different scales, different parameters which measure health only in one direction. So exact terms, health cannot be measured. This is a disclaimer which is going to be provided right at the start of the lecture. So, but still, we have a number of ways with which we can measure the health of a community. Fine. And what's that way? That is known as the indicators of health. In my previous lecture, I just gave you a little bit flavor that what is meant by indicator. Today, we are going to do it in detail. Health indicator is a variable. Okay, here I should explain the term variable as well. I think this might be a new term for you. Variable is anything, any quantity, any measure which varies from individual to individual, which varies from one situation to another. Okay? It's the simplest thing. If I ask you to name a few variable, what it would be? Height, weight, gender, blood pressure, blood sugar, any name it, you just name it, and that thing would be a variable, because majority of the things which are existing in this universe, they vary from person to person. Okay, so health indicator is a variable that reflects the state of health of persons in a community. Okay, fine. Okay. These indicators are also used to compare the health status of different communities. Now, the next point is uh, indicators, they comprise of a formula. Okay. Conventionally, in most of the situations, what are these indicators? They comprise of a formula, a mathematical formula. We have to put in certain things in that formula. Then we would be calculating a single measure on the base of which we can state that this particular indicator is good or bad. Okay. Broadly, we have categorized indicators, health indicators, into two broad categories. And what are those categories? Health status indicators and health determinant indicators. In our first lecture, which was regarding the concept of health, we did this. What we did in our first lecture, we defined health, and then we also discussed the determinants of the health. That what are the factors which affect the health of an individual? Fine. So indicators are quite in line with that concept. When I say health status indicators, they would include life expectancy, infant mortality, disability, or chronic disease rates. I'm going to discuss each one of these in quite detail. The next big chunk is health determinant indicators. What does it mean? All the determinants, all the factors which affect the health outcome. For example, diet of an individual, smoking status, water quality, income, and access to health. These are the determinants, and we have devised a range of indicators based on these determinants. Fine. Before going into detail, first of all, if we are going to plan, one thing all of you should have it in your minds, that indicator is something we can design our own indicator. Fine. It's not certain hard and fast rule, because these were also designed by some individuals, and then they were put into practical, and then they were evaluated at how significant they are, how much real they are. But the point is, every indicator should fulfill these characteristics. If any indicator which even you have designed, for example, a student among you want to assess that he is performing well during MBBS course or not. Fine. One of you has designed an indicator that you should take the mean of all of your professional scores. This can be one of the indicator of measuring academic performance. And then the student states that no, professional scores is just one thing. He or she should include the test marks as well. Okay, fine. This can be another indicator. Another student assesses that academic performance is not just a theoretical. They should include the hours spent in the clinical wards as well. He or she has included this parameter in the indicator as well. It's fine. We cannot say that one indicator is correct and the rest are the wrong. There is nothing correct and wrong, but the thing is how sensitive they are. And how we can infer this कि ये indicator कितना sensitive है? It will be inferred by applying that indicator and then checking its validity again and again. Fine. So if any indicator that someone has proposed, we have to assess it according to this criteria. If the indicator is fulfilling these characteristics, we would say that this is a good indicator. What are these characteristics? First of all, valid. What is meant by valid? Valid एक journal term है. We are quite in practice of using this term, but what does it actually mean? Valid means that parameter should have the capacity to measure what it is supposed to measure. For example, we have a weighing machine. Fine. If a person stands on that weighing machine would be only measuring the weight of the individual. Fine. We all know that height से उसका concern नहीं है, किसी और चीज से नहीं है. That is only to measure the weight. हम कहेंगे कि ये valid है. If कोई examination system है, उस पे बहुत ज्यादा वेरिएशन आती है कि एमसीक्यूज कितने वैलिड हैं नॉलेज असेस करने में, एससीक्यूज कितने वैलिड है नॉलेज असेस करने में, या फिर वाइवा, हाउ वाइवा इज वेल। अब वैलिड क्या है कि वो वही चीज मेजर करे जो हम उसमें से एक्सट्रैक्ट करना चाह रहे हैं। फाइन, सो एवरी इंडिकेटर शुड बी वैलिड, reliable. A thing becomes reliable when it gives the same results under different circumstances. Fine. Sensitive. Sensitive is that they should be sensitive to any changes, one definition, and they should measure what they are supposed to measure, nothing else. Specific, feasible, relevant. These are the few characteristics of an indicator. Any indicator should fulfill these characteristics in order to be considered as good indicators. Okay. And why these indicators are used? Why do we need them? First of all, they help us in the measurement of the health of the community. Fine. They also describe the health status, because if randomly I ask that what is the health status of Pakistan, Bangladesh, India, how can, if it can be subjectively asked, I can ask the citizens of that community, or I can ask the external evaluator as well. But how I can compare them? If students, you have to keep this thing in mind. जब भी हम कोई चीज कंपेयर करना चाहते हैं, whenever we want to have the comparison of different communities against a single parameter, we need to have an indicator. हम किसी एक fixed exam, if for example in your class, if I have 10 students who are performing very well, fine, now I want to compare these 10 students, where they are standing, who is the best, who is the worst, who is in the middle. How I will evaluate them? I will evaluate them with the help of certain exam, fine, and the scores of the exams would be the indicators of their performance. But the point is, I would be evaluating them against the same exam. It's not that I will be providing a different examination paper to one individual, different, no. All those 10 students would be evaluated against the one paper, fine. Therefore, if I want to assess the health status of 3 or 4 different countries, they should be evaluated against same indicator. Then, so these indicators are used, then these indicators are used to assess the effectiveness of an intervention. In public health, in community medicine, you are assessing that we have different programs. For example, polio control program, we have tuberculosis control program, and we have, or just name it, nutrition program. We have a number of programs. If we want to assess that this program is performing good or not, how can we assess it? With the help of some indicators. Okay, up till now, what we have done, that what are the indicators, why they are important, and in order to calculate these indicators, from where we would be getting the data. This is a very important thing. जैसे मैंने पहले कहा कि these indicators comprise of formulas. Fine with it. If they have the formulas, it means that we need to put in certain values inside those formulas. Got it? From where we are getting those values to be inserted into the formula. This is the very important thing, because if one country or one community is not having the good sources of data, genuine data nahi hoga, to indicator bhi wo cheez calculate nahi kar sakega. Fine. So if we want to calculate something, indicators, we need to gather that information from different measures, like from census. We have registration systems. आप इसको ऐसे समझ लो that in Pakistan we have the NADRA, National Data Registration Authority, and there we have to these registration systems have to register all the information regarding vital statistics like mortality, regarding fertility, birth, regarding all the details of the different population. Then we conduct surveys, special surveys like nutritional surveys, fertility surveys, on things like that, economic surveys, and we can have data from them. But mind it, these are all authentic sources of data. It's not that we take some, कोई आपने Google करके कोई एक information निकाल ली है कि जी यहाँ पे पाकिस्तान में reproductive age की females इतनी है या under 5 years के बच्चे, because then that data is not, that kind of data is not trustworthy. So if we want to calculate indicators, if we want to put in the values in the formulas of the indicators, we should have authentic data. and from where we can have that authentic data through census, through registration systems, and through properly organized service. Okay. Now what I'm going to do today is I would be giving you an overview of the indicators. ठीक है कि कितने types के होते हैं broadly और उनके कुछ कुछ आगे से हर एक एग्जांपल की so that you people can have an idea कि जी indicator होता क्या है, and you people should be able to name a few indicators. Fine. Otherwise, when you people would be doing different modules of public health like maternal health, child health, nutrition, and communicable diseases, non-communicable diseases. When you people would be doing these modules individually, you people would be discussing their respective indicators as well. Fine. So no need to worry if you are not able to memorize or grasp all the indicators today, because today is just an introductory lecture, what you are going to study in near future, inshallah. Fine. So how we have classified the indicators? Mortality indicators, morbidity. I think, I hope that you know the difference between these two quite well. Mortality relates with death, morbidity relates with disease. Then disability rates, nutritional indicators, healthcare delivery indicators, utilization rates. I'm going to explain all of these. Then social, mental health, environmental, and you can infer this thing very well from these slides that all these classes of indicators are in relation with the dimensions of health. We explore that in health we have physical, mental, social, environmental dimensions, and these indicators are in accordance with those dimensions of health. Okay. Now quickly, first of all, we have the mortality indicators, because it is rightly said that no phenomena can be more universal than birth and death. These are the two phenomena which are the most universal in this universe, right? Birth and death. So we need to calculate it. We need to assess different countries. To for mortality, the one of the most basic indicator is crude death rate. Fine. कि किसी भी country में, किसी population में, किसी community में death rate क्या, and how it will be? It is defined as number of deaths per 1,000 population per year in a given community. इससे आप अंदाजा लगाएंगे कि ये जो indicators होते हैं, these are basically the rates. ठीक है कि कोई फिनोमेना किसी फिक्स्ड कम्युनिटी में किस रेट पे हो रहा है. Therefore, every indicator has a न्यूमरेटर में क्या आ जाएगा? वो इवेंट ऑफ इंटरेस्ट जिसको आप कैलकुलेट करना चाह रहे हैं. यहाँ पे इवेंट ऑफ इंटरेस्ट है डेथ. ठीक है, नंबर ऑफ डेथ्स. डिनोमिनेटर में क्या आ जाएगा? वो पूरी पॉपुलेशन जिसके अंदर आप कंट्रोल करना चाह रहे हैं, लाइक पाकिस्तान है, इंडिया है, बांग्लादेश है, या लाहौर है, डिस्ट्रिक्ट्स हैं डिफरेंट. लाहौर के अंदर भी छोटा सा कोई टाउन है, यूनियन काउंसिल है, इवन वी कैन कैलकुलेट इट देयर. फाइन. और उस गिवन और एक फिक्स टाइम में. It's not because अगर आप देखो मैं सेंसस से ये इंफॉर्मेशन निकालूं कि पाकिस्तान में ये पिछले साल में क्या डेट्स है, आई हैव टू गिव सम लिमिट टाइम. ये ओपन नहीं हो सकता, पिछले 50 सालों की फिगर हम नहीं दे सकते. वी हैव टू गिव इट फॉर अ सर्टेन टाइम पीरियड. नाउ दिस इज द मोस्ट बेसिक ऑफ इंडिकेटर, क्रूड डेथ रेट. Persons are more interested in knowing कि जी पाकिस्तान, बांग्लादेश में फीमेल्स की डेथ रेट में क्या फर्क है. ठीक है, so this is the death rate in accordance with gender. So this is not a basic indicator. Now we have made it a specific indicator. Fine. So this is just an example कि जब हम mortality कर रहे होते हैं. अच्छा, mortality के साथ ही expectation of life है. Here I would like to answer that question. किसी बच्चे ने पूछा था कि जी how we can calculate the life expectancy at birth. बच्चे, this is calculated on the basis of data registries of that country. For example, Pakistan में any child who is being born today, आज एक ऐसा बच्चा that is born today, what is the how long do we expect him or her to survive? ये हमें कैसे अंदाजा मिलेगा? Based on the data sets of Pakistan. कि पाकिस्तान में on an average for a male and for a female life expectancy कितनी है, कि कोई भी क्यों ये मैं क्यों कह रही हूँ कि ये data set के based है? Because in Pakistan we have a certain set of physical, biochemical, environmental, social, economical factors. Fine. And all these factors in Pakistan are different from that of any European or American country. Or we can say that all these set of factors are different in Punjab than that in Sindh और बलूचिस्तान. तो जब वो factors different होते हैं तो हर शख्स की लाइफ एक्सपेक्टेंसी भी डिफरेंट होती है. फाइन. और ये लाइफ एक्सपेक्टेंसी को ये नहीं है कि एक जो बच्चा दैट इज गोइंग टू बी बोर्न टुडे उसके हम कुछ पैरामीटर्स कैलकुलेट करके करेंगे. नो, we would make these assumptions on the basis of the data of the last 10-20 years, that average age of survival was this for the particular area. अब WHO ने हमें जो यूनिवर्सल दिए हुए हैं वो क्या है कि for a male it's 64 years and for a female it's 68 years. Fine. So if we are talking about whole of the world, we can say that any child that is being born in this world today, for a male child the life expectancy is 64 years, and for a female child the life expectancy is 68 years. And these data vary from country to country. Fine. That is how we calculate it. Next, very important mortality indicator is infant mortality rate, and how it is defined. Number of deaths under 1 year of age. मैं क्यों कह रही हूँ 1 year of age? Because it is infant mortality rate. Fine. In definition of infant is any child that is less than 1 year of age, divided by total number of live births in the same year, and expressed. ये मैंने आगे जो चीज लिखी है expressed as per 1000 live births, वो क्यों लिखी है? बहुत से बच्चे इसमें कंफ्यूज होते हैं. देखिए, क्योंकि आपके पास अच्छा, जस्ट एन सिंसियर एडवाइस फॉर यू पीपल कि आप लोग व्हेन यू पीपल वुड बी स्टडिंग दिस कम्युनिटी मेडिसिन मॉड्यूल, kindly make this habit to jot down all the indicators, otherwise it will be a big hodgepodge at the end of the academic session. आप लोग एक अपनी कोई छोटी सी डायरी मेंटेन करो जिसमें you should write all these indicators उनके सही formulas के साथ, because you have to memorize a majority of them, not all of them, but you have to memorize a majority of them. अच्छा, हर indicator के साथ एक multiplier लगता है. ठीक है, जैसे मैंने इधर बताया कि number of children of 1 year of age, deaths among children less than 1 year of age divided by total number of live births multiplied by, कहीं पे 1000 आता है, कहीं पे 100 आता है, कहीं पे 100,000 आता है. नो नीड टू वरी अबाउट इट. ठीक है, मेजॉरिटी में और ये क्यों लगाते हैं? क्योंकि ये हम जो हमारे पास कैलकुलेटेड फिगर होती है वो बाज टाइम डेसिमल्स में होती है. जस्ट टू मेक इट मोर कॉम्प्रिहेंसिव, मोर इजी टू अंडरस्टैंड, हम उसको होल नंबर्स में करने के लिए ये मल्टीप्लायर लगाते हैं. If you are getting confused and you are not able to memorize कि यहाँ पे कौन सा multiplier लगना है, no need to worry. जो भी multiplier आप लगाएं, whether 100, 1000, 10,000, 100,000, the point is the same multiplier should be used throughout the formula and throughout the calculations. होता क्या है आपके लेवल पे, multiplier भूल जाते, कैलकुलेशन के टाइम पे लगा दिया 100, सारी कैलकुलेशन 100 में की, एंड में जाकर जब इंटरप्रिटेशन कर रहे हैं तो तब लिख दिया पर 1000. नो. अब इस बात को आप ऐसे समझें कि अगर मैं कोई चीज कहती हूँ 60, मैं कह रही हूँ कि 68 पर 1000 लाइव बर्थ्स है इन्फेंट मोर्टेलिटी रेट, फाइन विद इट. अब अगर इसको आप पर 100 में डिस्क्राइब करेंगे परसेंटेज में, तो द सेम वैल्यू विल बी 6.8%. इट्स द सिंपल मैथ्स, सिंपल मैथमेटिक्स. तो अगर आपको याद नहीं रहता कोई बात नहीं, लेकिन फिर कैलकुलेशन और इंटरप्रिटेशन में यू आर सपोज टू यूज द सेम मल्टीप्लाई. Only this thing has to be taken into consideration. Then similarly, we have under 5 mortality rate. This is defined as the number of deaths among children less than under 5 group, ठीक है, per 1000 live births. Okay, I'm just rushing through it because this would be taking too much time. Then we have maternal mortality ratio, very important indicator. क्योंकि किसी भी country में the two most vulnerable populations are females and children. ठीक है, any country that is investing well on its females and its children, that country is considered to be a developed country, a country that is moving in the right direction. In Pakistan, the MMR is 176 per 100,000 live births. Fine, that is too high, and we are working on it, and inshallah you people would be contributing towards this. The definition is number of females dying due to pregnancy or reasons attributed to it per 100,000 live births. अब यहाँ 100,000 क्यों आया है मल्टीप्लायर? क्योंकि जो बहुत से डेवलपिंग कंट्रीज हैं वहां पे ये वाली फिगर बहुत कम है, 0.0000. तो उसको एक्सप्रेस करने में, डिस्कस करने में डेसिमल्स में इट ऑलवेज गेट्स डिफिकल्ट. व्हेनेवर वी हैव टू मेक कंपैरिजंस, कोई आपको कहे कि एक कंट्री का ये रेट है 0.0006%, एक का है 0.006%, it makes no sense. लेकिन उसी चीज को जब हम ऐसे कहेंगे 6 पर 100,000 एंड 16 पर 100,000, इसको कंपेयर करें तो हम बड़े आराम से कंपैरिजन कर लेंगे। तो इसलिए इस वैल्यू में 100,000 का मल्टीप्लायर आया है, जस्ट टू मेक इट मोर पैलेटेबल, मोर अंडरस्टैंडेबल। फाइन। अच्छा, इसको आप बहुत डिटेल में पढ़ेंगे व्हेन यू वुड बी डूइंग योर MCH मॉड्यूल। अब ये दो बहुत इंपॉर्टेंट है, डिजीज स्पेसिफिक डेथ रेट, प्रोपोर्शनल मोर्टेलिटी रेट। डिजीज स्पेसिफिक डेथ रेट ये है, जैसे अब आजकल दिस इज द पैंडेमिक एरा, कोविड एरा, तो हर कंट्री को जिसको आपने कंपैरिजन करना है ना, उसके लिए आपको जस्ट क्रूड डेथ रेट सफिशिएंट नहीं है। आप चाहोगे कि आप आजकल इफ यू वांट टू असेस कि किस कंट्री ने कोविड को कितना अच्छा कॉम्बैट किया है, ठीक है, तो you would be very much interested in knowing their death rate due to COVID, कि पाकिस्तान में कोविड से कितनी डेथ्स हुई हैं, इंडिया में कोविड से कितनी डेथ्स हुई हैं, बांग्लादेश में कितनी हुई हैं, अमेरिका में, यूके में, सेम इज द थिंग। सो दिस इज द डिजीज। उसका फिर फॉर्मूला क्या हो जाता है कि आपके पास उसी डिजीज के सारे लोग और वो सारी डेथ्स जो उस पर्टिकुलर डिजीज से हुई होंगी। दीज टू इंफॉर्मेशन आर रिक्वायर्ड। अदर इज प्रोपोर्शनल मोर्टेलिटी रेट। इसमें फर्क क्या है कि जैसे हम कहते हैं कि किसी कंट्री में जो टोटल डेथ्स हुई एक साल के अंदर, उसमें से कॉरोनरी हार्ट डिजीज की वजह से कितनी डेथ्स हुई, ठीक है, हाउ मच प्रोपोर्शन ऑफ द टोटल डेथ पोल इज एट्रीब्यूटेड टू कॉरोनरी हार्ट डिजीज, दिस इज नोन एज प्रोपोर्शनल। इन दोनों में स्लाइट फर्क है। फर्क क्या है, डिजीज स्पेसिफिक डेथ रेट में ये आ जाता है कि भाई उस पर्टिकुलर डिजीज से कितनी हुई है, और प्रोपोर्शनल मोर्टेलिटी रेट में ये आता है कि जो सारी डेथ्स हैं उसके अंदर से एक खास डिजीज की वजह से कितना बर्डन है, ठीक है। I can understand very well that at this stage this might be appearing confusing for you people, but with practice, by reading it more and more, these things will get clear. इसलिए आपको ये डेथ रेट सारे अभी से बहुत अच्छे आ जाने चाहिए। नेक्स्ट इज मॉर्बिडिटी इंडिकेटर्स। अच्छा, मॉर्बिडिटी इंडिकेटर्स है कि किसी भी कंट्री में डिजीज का बर्डन कितना है, ठीक है। द टू मोस्ट कॉमनली यूज्ड इंडिकेटर्स आर इंसिडेंस एंड प्रेवलेंस। Fine. Incidence is the number of new cases of a disease, and prevalence means all cases old plus new. ठीक है, ये उस डिजीज का बर्डन बताते हैं। और हमें ये जो मॉर्बिडिटी इंडिकेटर्स है, इसकी इंफॉर्मेशन कहाँ से मिल सकती है? बाय द डेटा रजिस्ट्रेशन एट द ओपीडीज, हॉस्पिटल डेटा से हमें बहुत अच्छा मिल सकते हैं मॉर्बिडिटी इंडिकेटर्स, ठीक हो गया। Next is very important, that is the disability rates. अच्छा, ये आजकल बहुत important है because now it is said due to advancements in science and technology, now the life expectancy has increased. People are living longer as compared to previous years. But the new concept is that it's not just the longevity, it's basically the quality of life, how well they are spending their life. ठीक हो गया? तो इसके लिए disability rates लाए गए। For example, very important is Sullivan's index. What is meant by Sullivan's index? Life expectancy of the country minus probable duration of disability and inability to perform major activities. ठीक है, सिंपल लफ्जों में आप कह लें एक्सपेक्टेशन ऑफ लाइफ फ्री ऑफ डिसेबिलिटी। ये हर कंट्री को उसको आप कंपेयर कर, तो जिस कंट्री का ज़ाहिर है सुलिवान्स इंडेक्स ज्यादा होगा कि उसमें लाइफ एक्सपेक्टेंसी बहुत ज्यादा है और डिसेबिलिटी के ईयर्स बहुत कम है, इट मीन्स कि वहां के लोगों की क्वालिटी ऑफ लाइफ बहुत अच्छी है, ठीक है। हम जो डिसेबिलिटी में निकले हुए रहे हुए साल होते हैं, वेदर वो इनिशियल फेज में है, मिड में है, एंड में है, उनको हम लाइफ एक्सपेक्टेंसी में से सब्ट्रैक्ट कर देते हैं। नेक्स्ट इज हेल्थ एडजस्टेड लाइफ एक्सपेक्टेंसी। अगेन द सेम कॉन्सेप्ट है कि आपने उसमें जो डिसेबिलिटी या एडवर्स हेल्थ में टाइम गुजरा है उसको आप सब्ट्रैक्ट कर देते हो। नेक्स्ट इज डिसेबिलिटी एडजस्टेड लाइफ ईयर्स, डेली, ठीक है। दिस इज ऑल्सो वेरी इंपॉर्टेंट, नंबर ऑफ ईयर्स ऑफ हेल्दी लाइफ लॉस्ट ड्यू टू एनी डिजीज। एक शख्स, that person survived for 70 years, fine, but 5 years of his life were spent in he was bedridden due to stroke. 1 year was on bed due to certain fractures, fine, and 1 year was spent on getting treatment for tuberculosis. So the 10 1 1 12 years, irrespective of the fact that that person survived for 70 years, ठीक है, जो उसकी life के almost 12 years थे, they were spent in bad health, ठीक है, with disability. तो हम उन तमाम वाले को हम उसकी life expectancy में से subtract करेंगे और फिर हम बताएंगे कि now his life years are not 70 in actual, these are 58. Fine. That is how this is referred to as Delhi's. Okay, I'm just rushing. Then the same is the thing for quality adjusted live years. You have to give them a reading. ये हो गया आपके morbidity indicators. Now we are jumping towards the nutritional status indicators. आपने किसी डॉग कम्युनिटी की न्यूट्रिशनल स्टेटस को असेस करना है, कंपैरिजन करना है. हाउ विल यू डू इट? सिंपल. आपके जो एंथ्रोपोमेट्रिक मेजर्स हैं, height, weight, mid upper arm circumference, head circumference, ठीक है, these are the things which you can assess. Okay, for children, what are the indicators? Underweight, stunting, wasting, and overweight. Growth monitoring is very important. Fine. This was the nutritional indicators. Now we come towards the health care delivery indicators. This is very important for a public health physician. This is so very much important. आपकी कम्युनिटी में लोगों को हेल्थ सर्विसेज किस तरह से दी जा रही हैं, किस क्वालिटी की दी जा रही हैं, उसकी एक्सेसिबिलिटी क्या है, physical accessibility क्या है, financial accessibility क्या है. These are the things which are very important. इसको assess करने के लिए we have a range of indicator. जैसे आप ये चीजें देखते हो ना कि डॉक्टर्स पर 1000 पॉपुलेशन कितने हैं, नर्सेस पर 1000 पॉपुलेशन कितनी है. These are the health service delivery indicator. Utilization rate. Utilization rates आपको कैसे मिलेंगे कि आपने एक सर्विस प्रोवाइड कर दी, फाइन. To what extent they are being utilized by the population. For example, proportion of infants. अब हमारे यहाँ immunization दी जा रही है. You people have done expanded program on immunization. in जो tutorials आप लोगों ने पढ़ लिया कि पाकिस्तान में एक program है. Program available है, effective है, functional है. How well it is being taken up by the population. This would be referred to as utilization rate. कि वो जो program है उसको utilize कितना किया जा रहा है by the community. Fine. Proportion of pregnant females who receive antenatal care. This is also an example of utilization rate. Antenatal care centers बने हुए हैं, tertiary level पे भी बने हुए हैं, BHUs में भी हैं, हर जगह. लेकिन वो use कितने हो रहे हैं? This would be the utilization rate. Indicators of social and mental health. Okay, we have a number of them. There are environmental indicators. Environmental indicators के अंदर one very important. अगर आप health के perspective से environmental indicators देखना चाहेंगे, one very important is provision of safe drinking water. आपकी कितनी population है that has access to safe drinking water. Then radiation levels, noise pollution. Simply you can have that noisometer and you can assess the range of noise in decibels in different parts of your country, your city, your area, and you can assess that how healthy environment of a particular region is. Fine. So we have a number of environmental indicators as well. Then we have the socio-economic indicators. These are regarding the income of a country and how that income is divided and what is the dependency ratio. You would be dealing with these indicators quite in detail when we would be doing demography in your module. Okay, then we have the health policy indicators. Fine. Health policy is that how much some specific country is spending on their health needs. In Pakistan, as you people know very well, that what's the gross national product, our total income, and how much is the proportion of that income that is being spent on the health. And this is the homework. You have to just go through the Google and you have to jot down few points कि पाकिस्तान की जब पॉलिसी बनती है, बजट बनता है, उसमें हेल्थ के लिए हाउ मच ऑफ द जीएनपी, हाउ मच ऑफ द ग्रॉस डोमेस्टिक प्रोडक्ट, जीडीपी का कितना परसेंट हम हेल्थ पे लगाते हैं. एंड यू हैव टू फाइंड द सेम स्टैटिस्टिक फॉर सम डेवलप्ड कंट्री लाइक एनी ऑफ द यूरोपियन कंट्री या अमेरिका या कनाडा का आप देखिए कि वो अपने जीडीपी का कितना परसेंट हेल्थ पे लगाते हैं. दिस इज अ वेरी एंड व्हाट इंडिकेट्स इट. It indicates the importance any country gives to the health of its population. ठीक है, definitely ना कि जिस चीज की हमारे नजदीक ज्यादा इंपॉर्टेंस है उसी के ऊपर हम ज्यादा स्पेंड कर रहे हैं. Okay, next is the indicators of quality of life. We did it in our previous lecture. Now, in the end, I would like to summarize, and this is the very important chunk of the lecture, because now we have to bring it all under one umbrella, that what we have done today. We know that health cannot be measured directly, but indirectly by use of a number of indicators. Indicators use should be valid, sensitive, specific. It should be able to identify the health problems, needs, and to do the comparison. Okay. सिंगल ग्लोबल इंडेक्स कोई हेल्थ के लिए अभी तक वी आर इन सर्च फॉर इट, कि अगर कोई मिल जाए तो जस्ट वन इंडिकेटर जिससे हम हेल्थ को कंपेयर कर सकें, ठीक हो गया. बट द बिगेस्ट ब्यूटी ऑफ द इंडिकेटर इज दैट आवर होल ऑफ आवर पॉलिसी, हेल्थ रिलेटेड पॉलिसी, इज रिलाइंग ऑन दीज इंडिकेटर्स. वो ये इंडिकेटर्स हमें इंडिकेट करते हैं कि कौन सा एरिया है आपकी कंट्री में हेल्थ का विच नीड्स मोर फोकस, कौन सा एरिया है जो राइट डायरेक्शन में जा रहा है, कौन सा एरिया है जो रॉन्ग डायरेक्शन में जा रहा है. सो दीज इंडिकेटर्स आर डायरेक्शनल एंड दीज आर वेरी इंपॉर्टेंट फॉर पॉलिसी, फॉर असेसमेंट, फॉर कंपैरिजन. Fine. This was all for indicators, and you do give a good read to this chunk from the park. Otherwise, I'm just telling all of you that in the book, the notes book, which you are in habit of using, it has a number of indicators which are given with wrong formulas. And I think this is the most unfortunate thing when I encounter any student in the Viva, that they have studied, they have given time to public health, but they are producing wrong formulas. Why? Just because they relied on that notes booklet. ठीक है, तो अगर आपने टाइम भी दिया है और एक गलत चीज याद की है, nothing can be more unfortunate than that. अगर if still you are insistent on using those notes, kindly rectify it. अपने उन formulas को, इन चीजों को पार्क में से चेक कर लिया कीजिए, टैली कर लिया कीजिए. Thank you very much, बच्चों. That was all for today's lecture, and I hope you will read it, and you will, if you have any query, you can contact me anytime. And plus, we are going to share the notice for your first monthly assessment soon. Now, AIMC Medical Education has devised a full-fledged assessment plan, that every month you are going to have your monthly assessment, and then you are going to have your term test, and then you are going to have your send-up test. Fine. We are soon going to announce the schedule, the whole assessment calendar with you people, and then the syllabus for the first test will also be shared. So thank you very much. That was all for today's lecture. Stay safe.